Dr. Joanna here with Momenta Chiropractic, and I'm going to take you through our last portion of our series about sciatica. In this video, we're going to cover two of our favorite exercises to prescribe to patients to help them manage their symptoms. The first exercise that we're going to cover is one that we refer to as a position of relief. And this exercise is very dependent upon what we found in your exam previously. Remember in the previous video we talked about testing range of motion and how we want to find the motions that provoke your pain and then the ones that help relieve the pain. And now we're going to use that information that we gathered in the exam and apply it to an exercise. So the objective of this exercise is to help centralize your symptoms. And what I mean by that is you can have varying degrees of pain down your leg with sciatica, and we refer to that as peripheralization. But we want to bring those symptoms back up the leg so that they're isolated in the back and not necessarily traveling down the leg. So I'll give you an example so you can kind of visualize what I'm talking about. Say you had sciatica due to a lumbar disc herniation. When you have a disc herniation, you often have pain in a forward flexed position. So this would cause you a lot of discomfort. But when you extend backward, you might have a lot of relief. We can apply that information to this exercise by starting in a face down position. You can slowly work your way up to an extended position to help relieve some of those symptoms and draw them from the bottom of your foot up towards your back. If that's not quite enough, we can use a combination of movements to help alleviate that pain further. So you start in a slightly extended position, and then you can swing your legs to the side and again start to slowly get into full extension of your lumbar spine to help draw those symptoms up toward your lower back. And what this is doing is allowing the joints along the left side of your lumbar spine to open up and help alleviate some of the compression that might be pressing on the sciatic nerve or the nerve roots that form the sciatic nerve. So this exercise is very dependent, as I said, on the findings in the exam based off the range of motion and just positions in general that aggravate your pain versus alleviate it. So things like dosage, amount of time, amount of repetitions that you're practicing this exercise become very crucial to hone in on. That's where the exam is really important in this part. Next, we're going to talk about an exercise called the sciatic nerve mobilization. You may have heard this exercise referred to as gliding or flossing before, and that's essentially what we're doing with the nerve. We're allowing it to glide within its pathway in an unrestricted, non-painful manner. When nerves are irritated by compression, they become really, really sensitive to any kind of stretching or tensioning of the nerve. So this exercise is allowing us to mobilize that nerve in a way that is not going to excessively stretch it. So to do this, we lie on our back and then extend the leg that is symptomatic over your head. You're going to support the back of your thigh with your hands to allow your thigh to point straight up toward the ceiling. Then from this position, you're going to bend your knee and draw your toes toward your shin. From here, you're going to extend your knee so that your heel is driving up toward the ceiling. And if at the end of the range of motion, if you start to feel the symptoms come on, any sort of numbness, tingling, or pain down the leg, you want to back off an inch and bring your heel down just an inch. And from here, this non-painful spot, you're going to start to pedal your foot up and down. So again, this shouldn't be a painful motion to do because we backed off from that painful position. And we're allowing the nerve to glide back and forth along its pathway. So the objective of this exercise is to allow for that healthy movement of the nerve and bring down symptoms when you start to feel them come on, which is going to help restore the function of the nerve in the long run. These are just a couple of exercises that we like to prescribe at the beginning of our patients' treatment plans. But as they show improvement, we progress them further, make them a little bit more dynamic and specific toward the goals that they're ultimately trying to achieve within their treatment. Thank you so much for tuning into this series about sciatica. We really appreciate you taking the time to watch these. If you have any questions, please do not hesitate to ask. We'd love to be a resource for you. And keep an eye out for our future series on conditions that we're treating in the office.